segment of our health program here at Gasa Media, while we have been on the search of the recurrence of cholera outbreak in the Fako division, and we shall be talking about what it is, its causes, and how it can be prevented. And our reporter here, Immaculate Nalowa, has been on the search. So, Emma, what data have you collected about the occurrence of cholera outbreak in the Fako division?
Well, viewers, before diving into what took our interest into the community, Frida, we define cholera as an infectious bacterial disease which is caused by a bacterium named Vibrio cholerae contracted from mostly infected water consumption. And so, understanding the definition of cholera from the community, a lot of emphasis was made on the consumption of bad drinking water being the actual cause of this disease as to why it keeps reoccurring. Hearing from our community.
To the best of my knowledge, cholera is a bacteria that causes diarrhea and dehydration in human beings, yes, generally, and it's mostly caused by bad drinking water, poor or bad way of living.
Okay, so when we talk of cholera, I know one can get cholera through the water you drink. The bad water, like for example, forage. As we are drinking forage is not that good. Even when you fetch it, you look it inside, you can see the water is not clean.
Still with some health practitioners, Dr. Jumek, a general practitioner, gave her own opinion as to why there is a recurrent outbreak of cholera in Fako.
First off, cholera is a bacterial waterborne disease and it is very recurrent in Buea for two main reasons. There's always recurrent water shortage in Buea. That's one of the main reasons. And secondly, the past rainy period has been dominated by a lot of floods in the past few months. Yeah, the floods cause runoff of potable or dirty water into water bodies like streams, which people use as sources of drinking water.
Before knowing how cholera could be prevented, it is important to know the various means by which it could be transmitted into the human system. With this, Dr. John tells us more.
I'm Dr. Tracy John Gonga, a general practitioner working at CM in Buea, or Buea Subdivisional Hospital. It's an infection of the digestive system, so it can be gotten by ingesting or taking in something which has been infected by that bacteria, taking in something through the mouth which contains the bacteria, Vibrio cholerae.
Cholera, like any other disease, has its signs and symptoms as recounted.
So mainly the signs and symptoms are vomiting and watery stool or diarrhea, profuse repeated vomiting and profuse repeated passing out of watery stool. Usually for cholera, the stool is, they say, rice water in color, kind of whitish, like water which has been used to wash rice. And the other symptoms come as a result of these two main symptoms which I've mentioned, the vomiting and the diarrhea. The other symptoms may now include symptoms of dehydration because of the passing out of watery stool and vomiting. Water and electrolytes are lost, which we call in medical terms dehydration. So there are certain signs which can be seen, and it will tell us that this person is dehydrated. For example, extreme weakness, dryness and cracking of the lips, extreme thirst. The patient can feel extremely thirsty. And now in the hospital, there are other things which can be checked to confirm dehydration. There is dry oral mucosa, there are sunken eyes, reduced skin turgor, etc.
To avoid being cholera infected as individuals, we must take into consideration the following preventive measures.
For the prevention of cholera, I feel like individuals should be able to take care of their personal hygiene, the way they care for what they eat, what they cook, the environment they live in and all of that. They should take healthy measures.
Cholera is a disease that affects many people. So it affects people by when they drink dirty water or eat raw foods or food that are not well cooked. So to prevent cholera, you have to cook your food very well, drink clean water or boil water before you drink it.
First of all, hand washing is very essential, because when we touch something which has the organism, and we touch our food with the organism and we eat the food, we'll definitely become infected. Also, the food we eat, especially foods, something which is not supposed to be cooked, like fruits, they have to be well washed and eaten when they are fresh. And as for things which are supposed to be cooked, they are supposed to be well cooked for the germ to be killed. The water we drink is also very important. The way we handle the water we drink and the kind of water we drink is also very important in the prevention of cholera, because the disease-causing organism, the Vibrio cholerae, can be present in water. So we should try as much as possible to drink clean water. And if we are not sure of the purity of the water, we can locally purify it at home before drinking. For example, we can boil. We can let the water boil for about 5 to 10 minutes from the time it starts boiling. And after cooling it, we can drink. We can also use what they normally call in the water eau de javel, camel water, and purify our water with it before we drink. You earlier asked about how it was.
And so, viewers, haven't heard from our sampled population on what cholera is all about, how it is gotten and transmitted, its signs and preventive measures. We couldn't live without getting a word of advice from our health practitioners.
The main thing which can cause death in a patient with cholera is dehydration. So once symptoms are noticed and cholera is suspected, measures should be taken to prevent dehydration. Locally, people have been taught in the community about how to locally make oral rehydration solution with water, some cubes of sugar, salt, and maybe lime or lemon. So once symptoms like that are noticed, the patient should start taking locally made oral rehydration solution before rushing to the hospital.
Sum it all, health is wealth and prevention is better than cure.
Saying goes thus, health is wealth, and it is better to be safe than never. Thank you for staying tuned to Gasa Media. I have been Mofo Frida collaborating with
Immaculate Nanoa.
Do not forget to like, share, comment, and subscribe.